Welcome here to our next session of our Mars webinar. It's Thursday, July 29th, 21, and as always, last Thursday of the month at 9 p.m. here in Germany. We have our webinar about the topics of market access and reimbursement. My name is Lutz Vollmer, and I will be your moderator tonight. So just before we come to our topic about the German elections ahead and the potential outcomes and its implications on the healthcare market access, let me give you some general information. Okay. Mars, who's Mars? Who are we? Mars is the German-speaking market access expert for your topics about pricing and reimbursement strategies, reimbursement submission for the German GBA, or we have now also digital applications here, apps which are reimbursed, and also with the Swiss BAG or the Austrian Hauptverband. And we support you, of course, with every topic about the health economics and the negotiation support. And when it comes to price negotiation here, we have really nice developed a virtual reality preparation camps. It could be also something for your students, Professor Wagschal, when they are really nervous, right? So that's really like a training how you can have here the price negotiations. And also, when it comes to price negotiation, let me point out our next webinar, which is with our good friend Bibiane Schulte-Bosse, hot topic in August. It's about the price negotiations in Germany and live or let die, or even die harder. Yeah, so that's, you don't want to miss that, August 26th here at 9 p.m. German time. And then we go to Austria, we go to Mozart and Sissi and Sacher Cake here in September, and with our good friend Thorsten Peske from Austria. And then in October, we have something special. Dr. Matthias Perlet from the Federal Joint Committee in Germany is also joining us here about the experimental coverage here in Germany. That's a really interesting topic also. But coming back tonight, dear audience, your questions are welcome. So feel free to ask questions after the presentation. We will have time for your questions. You either use here the Zoom chat function or the Q&A function here in Zoom. Both will work. And the first question, as always, can we watch that video afterwards now about slides and stuff? So yes, we will provide that video on our website, which brings me to our website, www.marketaccess-pricingstrategy.de. And here you find the English sections with the webinars and also with all the nice webinars we had. For example, the one with the former head of the arbitration board for the drugs here in Germany of the AMNOG system, Professor Dr. Uwe Wagschal. So, and of course, subscribe to our YouTube channel. It's a great resource here also. Yeah, but now let me introduce you your speakers tonight. On the one side, we have Dr. Stefan Walzer, who is the founder and CEO of Mars. Stefan is a health economist with a long career at market access at Roche. And really welcome here to Weil am Rhein. Hello, Stefan.
Hi, Lutz. Good evening, everybody.
And also tonight, we're really happy to get him here because, you know, when it gets to political elections, it's just natural that political experts and such tremendous experts as Professor Uwe Wagschal don't have time. So we're really double happy to have him here tonight. Really welcome here. Good evening, Professor Wagschal, to Freiburg.
Good evening. Warm welcome from Freiburg.
So you both, Germany's elections are ahead. What are the potential outcomes and its implications? Stefan, would you want to start?
Very good. Thank you, Lutz. Thank you again for the introduction. Obviously, as well, a big welcome from my side to Freiburg, Professor Uwe Wagschal. I think we're looking forward to also those kind of insights. So today we'll have, I think, a slightly different kind of, let's say, presentation mode. So, you know, I will just very briefly introduce, and then I think the core part will be with Uwe Wagschal, and I will then basically, let's say, round it up basically with the market access implications, the potential ones, because obviously nobody really knows, and nobody was seeing, for example, that the AMNOG was introduced roughly 10 years ago now, and that was even with a liberal health minister. So that's also something maybe keeping in mind. But before going there, obviously, big question also just last week in the New York Times. What do you need to know about Germany's national elections? For sure, most important probably, we'll have a new chancellor starting probably this autumn or maybe winter. Depends also a bit when and how fast the coalitions could basically come together. Next slide, please. But besides the new chancellor, it's also important, obviously, keep in mind that maybe, I personally think the likelihood is rather high, so also looking forward to hear maybe what Professor Wagschal thinks about it, but I think that maybe, and potentially high likelihood that the current kind of health minister, Spahn, might no more be in that place. Maybe he will get another part in the new kind of government, but let's just see. I think important is probably we just try to put the most important laws, and it's not Murphy's law, there's some Spahn's laws, and I think you see he was very active, and I think most importantly, next slide please, Lutz, I think on the market access there were also a couple of very important impacts, and again, some of you might just sit here and say, some are missing here for sure. We've just thought we just put some of the important, really important kind of things in here, like in the very early beginning, the DRG changes by excluding the care costs, which I think might have had also kind of impact, let's say, for example, on some of the medical device, let's say, submissions and those kind of calculations. Obviously, quite important, we had already some webinars on that, the so-called DGAS, the digital health applications, big kind of change, and obviously together with that, not even mention that slide, the whole kind of digital health, let's say, packed in a way for the hospital future as well, which has also been put on the road. I think strengthening the use of biosimilars, I think was also in, let's say, in some part, in some different laws included, and I think also just recently the so-called DPAS were also included, so DGAS, health application, and we have also the digitale Pflegeanwendung, it's basically care applications, the digital ones which are then also put into the whole kind of endeavor. And finally, I think this is very new, I think in one of the last laws which have just been put into force, for example, for the 18Ps, there's now even a second opportunity per year to submit an NUB for all of those. That's basically around the market access in the hospital area. So not only in October, but then also second part and in April in order to also bridge that sometimes quite long gap into the kind of healthcare market access for hospitals. So you see quite a lot of impacts, I think, also in the last, let's say, 4 years. Obviously, not only Spahn himself, but obviously as well the whole kind of ministry and a couple of further, let's say, endeavors by the various stakeholders. So that was the past. Let's have a look what might basically be expected, what might come, let's say, after the elections in autumn 2021. What we all know, obviously, and I think that's probably, and I'm also looking forward to hear further kind of insights from Uwe Wagschal. Is there a potential change of interest of voters? And I think what we have put in there is maybe more kind of hypothesis, right? Because of COVID-19, the whole kind of pandemic situation, I think the whole health system has been put much more into the focus, right? It's vaccines, but it's also basically the different kind of medicines, the drugs, and finally also big debate here, it's the different kind of investments and its financing. So let's just see what the kind of current forecasts, what the current kind of insights will tell us, and then I think we might also try to have a kind of, let's say, forecast also in terms of market access, what might potentially be happening already, probably as soon as 2022. So having said that, I'm directly handing over to our special guest tonight, Professor Dr. Uwe Wagschal. As already said earlier, he's the chair of the comparative politics at the University of Freiburg. And having said that, I think Professor Wagschal, you have also, let's say, invented and using a lot, for example, those kind of very nice tools like the VoteSwiper and a couple of other things, which I think you will also now bring into more life, because I think you also brought a couple of insights and new results out of the forecast for the elections in autumn. The floor is yours.
Thank you very much. So the next elections in September 26th, they will be peculiar from different perspectives. So what we've seen the past years in Germany is the highest political polarization between left and right, between, let's say, the Greens and the nationalists on the other side. So various angles where we can observe high political polarization that will be even stronger after the elections or during the election campaign. The second very important aspect is that we have, for the first time in history in Germany, that the incumbent is not running for the chancellorship. So going down all the 70 years, we had always the chancellor running for being re-elected. So that's new. And a third very interesting aspect, we will have 54 parties struggling for seats in the parliament. The last time was 42. So this also our record high number historically. And we will also have record high numbers for a postal vote. And this is important since postal vote, they cast the votes earlier. So they start, casting the vote 1 month before the elections. And that will, so to say, impact also the results, since short-term effects just before the elections will not have an effect. So next slide, please. So if you see the outline, you see, I will talk about the electoral system quite quickly, then the party identification, how it is developed, the candidates, the main subjects, and then I will deal with the government formation. Finally, I will talk a little bit about public health implications with relation to public health. So next slide. So if you look at the data at the moment, where are the parties standing? You see 2 months ago, the Greens were in front for a short period of time. So the Christian Democrats came down. That was so beginning of the year quite high numbers in the opinion polls for the Christian Democrats. Since the year before, 2 years before, they were around 25-26%, and also during the term. That was quite lower numbers, so that was a good period. So there was a rally around the flag during the Corona pandemic, and then with the increase of the new campaign of the Greens, and in relation with the environmental problems, the Greens gained many support in the opinion polls, but due to the scandals over the past weeks, they came down. And we see there's obviously now a large a large advance for the Christian Democrats. So that will be, so to say, an important data to know. The Greens second, closely followed by the Social Democrats, then the Liberals. The right-wing AfD is fourth, and then the left party, so to say, just above the threshold of 5%. Next slide, please. So also important is, of course, the electoral system. Since the electoral system has some interesting features in Germany, we have 2 votes. And with the first vote, we vote the 299 electoral district seats. And with the second vote, we that's a party list. We vote, so to say, party itself. But for the percentage in parliament, only the second vote is decisive. So the first vote is how to, so to say, adjusted to the votes gained with the second vote. And important features, of course, the threshold. In 2013, we have had the Liberals and the AfD. They were just with 4.7 and 4.8%. They were just below the 5% threshold, and so maybe the left is also in danger not to reach the. But I still believe that they will be above the 5% threshold. But nevertheless, there's a chance that they will be under. And that is a game changer, of course, considering the majorities in the end. So we have a very complicated compensatory mechanism. And this now in the end leads to 709 seats in parliament, whereas the legal number of seats in parliament is 498. And this is also a record for Germany and worldwide. We have the largest democratic parliament worldwide. And there's a fairly chance that it will be increasing even more after the elections in September, when we have, so to say, even more volatility and even more parties with a similar size in the German Bundestag. But in the end, it turned out that Germany has a very proportional electoral system, especially when we compare with all the other democratic countries around the globe. Next slide. So if you look at the first votes, I said quickly in the beginning, we observe a huge polarization. So historically, we could have seen only red and black on the country map for the district votes. And after 1990, it turned that we have somehow fragmentation of the party system. And now we have 5 parties which have won direct seats. And you see the Christian Democrats are the strongest, so that's the black. But if you turn to the next slide, there are projections for the outcome. We see that we will have even now some more direct seats for the Greens, maybe also for the AfD. That's a little bit unsure. But this, so to say, the projections for the constituency just from this month indicate that we'll have some more Greens and even some more diversity than in the record high last elections 2017. Next slide. So what we can probably observe if you compare the vote shares of the second vote with the projected outcome, that we will see some losses for the Christian Democrats, even they are quite strong at the moment. So we have to add up the Christian Democrats and the CSU. So last time 33%. Now they are at 28. Maybe there will be some catch up just in front of the elections. The Social Democrats will also lose a little bit. The left will lose, but the Greens will win. However, you will see when we think in terms of blocks, the leftist bloc consisting of the left, Social Democrats and Greens will remain fairly stable, as is to the bourgeois bloc or the center-right bloc with the Christian Democrats. The Liberals, they will gain the Liberals, and the AfD, they will remain fairly stable. So there will only be slight changes between the blocs, but they will be in the end decisive in terms who will govern the country. An important feature in Germany is that, as it is in all settled industrialized countries, that the voters get older and older. And I apologize for my German slides, but I will translate it. So what we see is the average voting age and the median voting age according to the statistics. We had some years where we don't have had data because it was forbidden to collect the data. But we see that the average voter age is going up around 54 the last time, and probably maybe even higher this time, around 56 years probably, since younger people tend to go to elections less likely than the older ones. And what is interesting that the politics, so to say, takes this into account. If you look at the government spending, and I think the very important spending are the increase of pensions. You see that in front of elections or election years, the pensions increased much higher than in years between the elections. So we see kind of political cycle. And well, this year we had the crisis, but nevertheless they changed some things that usually the pensions should have gone down, but they had introduced a regulation which is not, so to say, taking in place. And this is also relevant for, of course, the health market, since societies are getting older, the voters getting older and becoming more and more important. And therefore, you see we're spending more for pensions, more for the elderly, and in the aggregate also, of course, for the health. If you look at the spending categories in our social budget, you clearly see that the care is the largest increasing sector, followed by the health, and then the pensions. And this goes badly to the elderly. And and they're voting for parties promising, of course, improvements in these sectors. So this is a very, very important thing to understand. Why are especially elderlies, and if you look at the average voter age for Christian Democrats, they're 57 years, for the Social Democrats 56 the last time. They're voting for social policies introduced by these social parties which are in favor of social policies. Yeah. So next slide, please. In political science, we have so to say, very prominent model to explain the voting turnout, the voting decision. This is called the socio-psychological model of voting. It consists basically of three variables: party identification, the subjects, the policies, and the candidates. So when we go on to the next slide, we have asked after the last elections 5,000. So I'm running a huge panel. This is called the Politikpanel Deutschland, and we have had 5,000 in our poll just after the election, and it turned out that the party program is the most important one, followed by the party identification, which consists of the item "I always voted for this party," which 13.9%, and party membership, and on the third rank is the candidate. However, the candidate becomes more important over time as party identification, party membership goes down drastically. So we see a huge shift from these factors to the candidate. So the candidate becomes more important, and this would probably help, I would guess, more the Christian Democrats than the Greens. However, also the Social Democrat candidate is, after the scandals of the other both running mates, obviously quite in a good position at the moment, I would say, better than some months ago at least. This you can also see in the exit polls. However, there's some other economic factors. So you might ask what is important economically. So we have 4% telling us that this is the most important thing. So the next slide. So party identification, as I said, is going down. So most of us have a long-term, stable, effective attachment to a political party. We don't often change this. It is formed in our youth, and however, we see a alignment in the aggregate. It's not that strong than in earlier decades, and even we have some realignment, so maybe for the AfD or for the Greens, and these parties gained in support. However, compared to other countries, Germany, we have a rather stable party identification, compared to Italy, for example, where we have a turnover of the whole party system, or France, also a whole turnover of the party system, and the Netherlands with huge changes. And therefore, party identification has changed and is changing, but nevertheless, still important in Germany. If we go to the next indicator, the importance of the candidates. Well, as I said, the candidates gained in importance since the erosion of party loyalty, and it turned out that the candidates is, so to say, a decisive actor, a decisive factor, just in the last 6 weeks or 8 weeks in the electoral campaign. And in Germany, we have two huge debates, one with the RTL television broadcaster and the other one on the 12th of September. And we have researched over the last years these discussions on television. And my guess is though, and it will be a 3L, so the three main candidates were running in this debate, in these two debates, and those who is winning in this debate, this one will also win the election in September. Next slide, please. So if you see now, this is the opinion polls, the rating of the politicians at the moment. Angela Merkel at the end of 16 years, quite high, even record high numbers. If you go back the past 4 years, so she is far above all the other candidates or the other politicians. This is quite surprising after the refugee crisis in Germany 2015. She had bad ratings at least 2 years after the crisis. But at the moment, Söder would have been probably a better candidate according to this rating. But if you look ranked currently, Scholz is in front of Laschet, and followed then by Baerbock, who had struggled with several scandals. It would take some hours to explain all the scandals of Baerbock, but nevertheless, the Greens have a high, and with a probably other candidate, Habeck, you see, he's close to Scholz. Probably the Greens might have reached the 20% in September, but at the moment it's more or less unlikely that it will reach the 20%. Next slide. And of course, as I said, the issues, they are the most important factors. Of course, they're correlated with the other ones, with the party identification and the candidates. So if you're left, you're in favor of say spending more, then you vote for a left party. Then you are also in favor of these issues, and when you're on the political right, you also tend to have same opinions than your party. So these are correlated, these three variables, as I said earlier. But nevertheless, it's important to look what is the salience of the issues currently in Germany, right? And so the issues play a big role, and many voters are looking at the party programs, or using tools like the Valomat or the VoteSwiper, which I'm organizing. So that these are voting advice applications, a useful tool. And last time, I think, if you add them up, around 14 or 15 million used both tools together with the VoteSwiper, only 1 million. Okay, the next slide, then you can see that we have a huge variance concerning the salience of the issues. So this is the data from the Forschungsgruppe Wahlen, that's the leading institute in Germany for election research and opinion polls. And you see the past 21 years, since 2000, huge variation, especially 2015, that was the yellow with the migrants, the foreigners and refugee crisis. And the last 2 years, we see the coronavirus was the most prominent subject. Before that, the environmental. And you see just last month, the environmental subject gained in importance, which might help the Greens again a little bit, where the other, with coronavirus pandemic, clearly helped the Christian Democrats large extent, and the Social Democrats to some extent, compared to 2 years ago, the opinion polls. So the subjects probably will dominate the discussion during the last 6 months of the election campaign, but nevertheless, I would guess there will be some new subjects also coming around the corner. We have seen the flooding in Germany, maybe the dealing with the crisis. In 2005, we also had a flooding during the election campaign. That helped during that time very much the Social Democrats. They nearly won the elections, but in the end, the turnover. But you see, crises are maybe, I wouldn't say a game changer, but they can influence the elections heavily. So we still have 6 weeks time, and it's not sure what's coming around the corner. And probably looking at the economic data at the moment, inflation, public debt, and also taxation might gain in importance as they always did in historically. So what is really important, of course, is who will be forming the government. After the last election, it took more than half a year, so we had 3 or 4 months negotiations between the Christian Democrats, the Greens, and the Liberals, the FDP, and they didn't reach an agreement. So finally, the so-called grand coalition between Christian Democrats and Social Democrats remained in office. My guess is, according to the theories of coalition formation, that we will see a different government the next time. So I applied the 6 theories also last time, and I wrote a big article just in front of the elections. And I betted that we will have the grand coalition again, and finally in the end I was right, so happily. But nevertheless, so this is a scientific guess, and I used we have 6 theories, and so 3 of them are office orientated and 3 of them are policy orientated, and I won't explain the theories now, but in the end, if you apply them, the highest probability of applying these theories with the data currently is that we will probably have Christian Democrat and Green government. Some years ago, we would say this is very unlikely, but if you look now at, for example, to Austria, we have such a government, and if you go to Baden-Württemberg, where we are, we also have since several years a coalition of both parties, but with a Green as a prime minister in Baden-Württemberg. So there is a quite high probability that we will have this government, but currently you see applying the opinion polls to this to our electoral system, they would have only a majority of only 4 mandates. So that's the first row. So it's quite narrow. We have had governments with only 1 parliamentarian majority. But so to say, it would be easier to have a bigger majority, right? And maybe Christian Democrats are gaining. That would be a little bit more comfortable. But so in the second chance, if they need a third one, I would go for the Liberals. So that's the second option. So that we have a broader. Currently, that would be a surplus, a so-called surplus coalition. So they are quite unlikely. But if they change, as I said, that would be, so to say, my second option, followed then by a coalition of Christian Democrats, Greens, and SPD, but quite unlikely, I would say. Because the Social Democrats are fed up with the Christian Democrats, and after this long period of grand coalitions and the diminishing importance of the Social Democrats, I would say they will and would like to go in opposition. But if they could form a government with the Greens, option 4, they will do it. So that, but then they have to catch up, the Social Democrats and the Greens as well. But if you look here, the option is not that far away. If you add up the size of Greens, so in the last row, they have a majority at the moment, but also quite narrow, 5 seats. And finally, we have other options, which I would say are not, the 5th option is not that likely, but in the end, we can also have a very unlikely situation that the Greens will be stronger, the SPD will be stronger than the Greens, and then we have a similar solution than in option 4, and then the Chancellor will be Mr. Scholz. So the next slide, please. As I said, a coalition between the Christian Democrats and the Greens, so to say, is not would not have been surprising these days. 4 years ago, they negotiated, but if you look at the similarity of the party and comparing the party programs, and I did this with analyzing the Valomat, this is a very famous voting advice application, and they check all the party programs, and they use 38 testing questions, and you see the similarity between the left and the Greens are was quite high, whereas the similarity of Christian Democrats and Greens was rather medium-sized. But as I said, it changed and a little bit, and so to say, party programs are somehow something which is on the paper, but the real politics is somehow different, as we can see in Baden-Württemberg. That's the next slide. And I used the same data, and I produced a heat map with my own data from the VoteSwiper, which used 35 questions on where we checked all the party programs, and then we can compare the position. And you see the Greens are now in the middle on this left-right scale. So on the top, they're the left parties: Demokratie in Bewegung, Linke, Die Partei, Klimaliste, Pirates, Social Democrats. And on the other end of the scale, we see the more centrist party or right party with the AfD on the extremes, right? And you see here in Baden-Württemberg, the Greens are in the middle, more in the middle than in all the other elections before. And probably also this more realistic attitude of the Greens in Baden-Württemberg will influence the political attitude of the Bundesgreens to some extent. Therefore, I would say it's much likely that they will go together. Next slide. And this is also what the people want. So the Forschungsgruppe Wahlen is also asking which is your wanted coalition, your favorite coalition, and is the CDU-CSU Green coalition, which is wanted highest, followed by the Grand Coalition. But all the other options I discussed are either less likely or not really wanted. However, we don't have a majority for you see, only 15% are wanting this coalition. This is not a majority in Germany, so it's also very fragmented, right? We also always have a negative coalition against any form of coalition which will be in place. Okay. And again, another interesting data I want to show to you is, so we ask over the past 1.5 years, so with our political panel, 23,000 Germans in 3 waves, and you see the number of the waves from ranking from 7,800 to 5,500 over 1 year. And what we can see here is the answer to the questions, are the corona measures excessive? And if you look at the data, the Greens and the Christian Democrats and the Social Democrats, they are virtually the same, right? So it's the same attitudes, same tendencies. This was historically not so. The Green were rather more radical, rather outside, but they are now in the center of the political system. They moved from quite left position, as I showed, to a more center position, and also the voters, they become older, they become richer, they become more established. Interestingly, the liberals are moving away from the center, becoming more rightist, becoming more skeptical about corona measures, which also can be seen with other indicators: skepticism to the media, skepticism to governmental television, and so on and so forth. And of course, the AfD is even more right, and the corona skeptic parties like Wir 2020 and the Basis, they are very, very skeptical against the corona measures. Okay. Next slide. So I looked at all the party programs, and you see the pages, the page number, and how often is health mentioned in the party program. And I looked, and you can calculate, of course, a relative measure of health importance in the party programs. And what is clear, the more leftist you are, the more you put emphasis on health. But we also can observe different different objectives, different policy preferences in the parties. And I think the most important one is the question about the insurance system. This is relevant for you, since the left parties will abolish the established private insurance system and will introduce a common Bürgerversicherung, citizen insurance, introducing them for all the employees in the society. The second important subject, not surprising, is the corona pandemic. Then we have an important subject in the party programs, how to deal with the lack of employees, the wage problem in the healthcare sector, vaccination, digitalization, especially mentioned by the liberals. So then the role of the hospitals, should they be by state or private, and how many hospitals also important aspect, and finally the prices of the pharmaceuticals. So looking at the health policies, these are the subjects most often mentioned in the party programs. So if we move to the next slide, we see a detailed examination of the VoteSwiper, which I have introduced to you. So we ask all the parties, and I got the data yesterday. So finally, I was able to present to you the data. This is really fresh data, and we ask 23 parties so far. As I said, 54 parties will start in the run for the Bundestag. And here you see the question is: should private health insurance be reassigned in favor of general citizens insurance? And all the right parties say no. The left parties, Linke, SPD, and the Greens, say yes. And the free voters, which supposed to be liberal, more liberal, they also say yes. It was very surprising for me. But you see here a clear left-right divide, and especially for your policy area, that would be an interesting case to see when the Greens and the Christian Democrats will form a government, since the Greens are really in favor of the subject. So that would be, I would say, the most relevant issue for the next years in the healthcare sector, in addition, of course, to prices and vaccination and so on. But a really structural reform would probably happen in this policy area. And that was my presentation. Thanks for attending, and I would like to hear your questions.
Perfect. Very good. Thank you, Professor Wagschal. I think that was really great. So I'm just summing that a bit up, because I think you also just brought up the kind of cool question, obviously, what about healthcare? And I think you brought a lot of different things up. I think there are a lot of buzzwords in there, like I think robotic, digital health. I think it's basically mentioned in any kind of program, I would say. I think what's maybe a bit, let's say, different is terms like virtual hospitals, which is more mentioned within the conservative kind of program. AI is mentioned in there. I think integrated care is probably more kind of terminology between the Social Democrats, and I think especially the Liberals and the Greens. So it will be also maybe interesting, especially, I mean, as you have said, which kind of coalitions might potentially be included. I think not a big surprise, the Liberals are also trying then to focus a bit on further startups in the healthcare sector, and the Greens are also adding a bit more on DRG changes. I think the left, I think with maximum pharma pricing, stop of selective contracts, I would say probably a bit, let's say, on one side of the whole spectrum. I mean, the AfD is not yet even included. One step further, Lutz, I think healthcare is obviously one component, but the next one is obviously what about market access, right? So what about the reimbursement system, etc., and the whole kind of changes, which is maybe not even written in the kind of programs so far. Next slide, please. So I think when we have spoken with different kind of stakeholders within the system, from the political side, but obviously also different, let's say, members of the, at least the kind of statutory and private health insurances, I think the expectation is quite clear. I think given the various negative effects on tax income, obviously COVID, I think we've now just had as well the big kind of flood in some of the areas in Germany, which might also cost quite a probably significant amount of taxes. I think stakeholders generally would expect an entry into force of a saving law, meaning kind of budget kind of decreases, or maybe kind of budget kind of, let's say, thresholds for the overall kind of healthcare spending. What that mean at the end of the day? Not a big surprise. I think, as we have always seen, the easiest enemy, the easiest target is obviously, I would always say, the pharmaceutical industry. And I think what is also, I think, quite clear, I think probably not a big surprise for also different people who are working in that area. I think the likely changes, independent, I would even say, from any kind of new coalition until the end of 2022, is probably that the added benefit yet granted for orphan drugs would probably no more be holding within the AMNOG process. I think there are even discussions that this might even end as early as April 2021, but this kind of timeline is obviously very much heavily then dependent more on the kind of time when a new coalition, when a new government is basically really put into force. I think the second part in here, which might be maybe more linked to that potential further kind of, let's call it budget cut law or budget spending kind of law, it's probably more a kind of still, let's say, question. But I think also, having had those different kind of discussions so far, is that the free pricing at launch might basically potentially be changed overall. I think that would basically mean, most likely not as we see it in other countries, that you first need to go into the added benefit decision, and then finally, after the price negotiation, you can launch. I think the launch might still go ahead at the same time as with the dossier submission, and probably there's still the kind of, let's say, called more kind of theoretical pre-pricing in a way, because I think the expectation so far is that there might be even paybacks between the reimbursement amount, which is then having, let's say, putting into place after the negotiations, and the price at launch. So that is, I think, a quite likely scenario just for the pharmaceutical area, and I would even say as soon as basically 2022. So this might even mean that this is something to add into any kind of scenarios for market launches next year. Next slide, please. I think we have just spoken about obviously the pharmaceutical part. We have also, let's put it a bit more to perspective as well, the digital health application. I think everybody, I think even us, I think we don't believe that there might be big time of changes now, at least not in the short term, because this was just implemented a year ago. But I think will probably also be foreseen that that's again more going into the kind of cost savings, and we hear the different kind of feedback also from the, probably not so much from the ministry, but especially from the different stakeholders out of this health insurance fund, that there's at least already the kind of, let's say, discussions about the prices of those so-called DIGA. So I think at the end of the day, I think we see also more and more kind of, let's call it comparable DIGAs coming into the market. And I think it's quite evident that those kind of fixed amount grouping, what we also know from the pharmaceutical areas, so-called Festbetragsgruppen, might also be coming into effect. So meaning comparable DIGAs mean comparable efficacy, and at the end of the day, that would also mean a maximum price, which is then being fixed by the system. Furthermore, I think we've just discussed about the DPAS, the digital care applications. I think the expectation is also quite clear that that whole kind of process with respect to listing, but also in terms of benefit assessment and pricing / negotiations, might be probably merged, meaning they will have probably more or less the same, if not even, the similar, if not even the same kind of process than in starting probably already end of this year or next year. Next slide, please. What about the medical devices? I think at the end of the day, I think what we have also spoken with different kind of people, I think the clear focus was on pharmaceuticals in terms of, let's say, budget spending, those budget cuts. I think some more process-oriented changes in terms of digital health applications. And I think for medical devices, I think no big changes are expected with respect to reimbursement processes, even though obviously that there might be some changes in the financing of the hospital investments. We all know that regions, the regional kind of governments would basically need to as well take over some of that aspect. But we also know that there has just been implemented a new kind of law roughly a year ago with respect to digitalization of hospitals, and all of that might obviously as well impact medical device reimbursement potentially in the hospital. But I think this is probably just a kind of minor impact in that overall package. Next slide, please. I think ultimately, Professor Wagschal, you have also just put that into the discussion. I think the elephant in the room is still what will happen with those kind of, let's say, two parts in here with the Bürgerversicherung, the citizens insurance system, or I would even say kind of NHS versus the GKV, PKV system we currently have. I think we have clearly here, as you also said, a differentiation between, let's call it the kind of historically left kind of parties, even though that we have just seen that maybe the Greens are a bit more closer to the Conservatives, and the kind of conservative part with the Liberals and the Conservative Party in here. So the question is quite clearly, in which way might that then potentially even have a kind of bigger change in terms of reimbursement overall? But I think maybe my first kind of question, because I think we're at the end of the presentation for today, Lutz, and I would just directly include that. I think, Uwe Wagschal, you have just said, I think maybe the likely kind of coalition might be the Conservatives and the Greens, or maybe the Conservatives, the Greens, and the Liberals. So I personally would even say the elephant is there, but I think the elephant is already, let's say, quite consistent across the last elections. And I think when we see the different kind of potential forecasts, I would not expect bigger kind of changes within that system with those kind of two groups. What do you think with that kind of hypothesis? Thank you, Lutz.
Thank you both for this really great information here about that topic. Yeah, I think the big elephant in the room, but that actually, when I remember all the elections so far in the past, that was also always the elephant in the room, right? The hot topic. What is about that Bürgerversicherung? When I remember also the Social Democratic Party in 2000, that was like still on the agenda on them and the big fight. But how likely is it actually that even if the Green Party, right, they will now get a lot of voters and they will win that that election? How likely is it that it's really going to happen?
Should I answer?
Yeah,
I will attribute only a rather little percentage of likelihood, and I explain in the following way. The voters of the Greens, they work in the public sector, right? And the most or many of them benefit from this system, right? So they are private insured since they are functionaries of the state, and it's a real benefit for them. And so I would say, let's be a little bit more relaxed on this issue. We have other issues like the environment, and in some weeks you will have Mr. Walzer. He's a real expert on this, and I would say it's very, very unlikely that, because it's such a huge tanker, and we have also had always these huge tankers to reform, like the pension scheme and the health scheme is the second largest one in Germany, and to reform such tankers with so many vested interests is very, very difficult. We have veto players in the system. We have many money in the system, so liabilities, and they've saved. And therefore, I would say it's more unlikely that we will have the reform that we in comparison that we will see a reform in this area. But when we have a reform, that will be a real great reform if you go back to German history and the importance of the sector.
Wonderful, great answer.
I would agree. I think it's probably a big kind of point, I think, also to mention, and I think we have still more than 100 subsidiary health insurance funds and also more than 100 private health insurances, right? So I think it is, I think, a big kind of change which might also be, let's say, has to be then implemented with all of those different stakeholders. And this is just the health insurance, right? Not even thinking and discussing about all of those kind of other sectors. I think it's also the question, for example, how then those KVs would basically as well play a role, in which ways they would then as well potentially get into those kind of discussions. So I would agree. I think it's probably rather a kind of low likelihood.
Okay, and then we have our great listeners from Canada, actually, James Dorset, and in Canada, actually, there's they introduced a national pharma care program, making pharmaceutical products available on the basis need rather than on the ability to pay, and there are equities and equities and a patchwork of insurance programs. So we don't have that. But are there any parties, do you know that, Stefan or Professor Wagschal, if there are any parties that consider such a national pharmacare programs? I think that is not a topic here, right?
It's not a topic. I know there's a small special interest group party. This is called the Health Party, Gesundheitspartei, single issue. And when I recall it right, and when I read their program, they are a little in favor of such a thing, but they always want more. So for that area, I'm not sure whether, so they're not relevant, right? And so it's not an issue in Germany.
Yeah.
No, I would agree. I think equality is probably given. I would generally say, I think, especially if you would compare that against a system such as in Canada, also for example in the UK. But I think what might be maybe more important is, I think nothing will be discussed today, but I think we have it probably in December. Looks, I think for the webinar, it's probably the joint HTA across Europe, right? Which is probably more the kind of potential hotter debate for the reimbursement system itself. So the insurance system is one thing. Equality is probably not so much of a big debate in Germany, but I think equality might drive the European Commission, especially with the joint HTA recommendation or suggestion.
Mm-mm. Is it just a too complicated topic? Because I know that the private versus the state health insurance, right? This is like a simple system also the voters can understand, right? Because you just know you're either private insured or state health insured. So, but when it's go deeper and deeper, it's just out of the scope of the voters.
Yeah, it's already said. I think if we basically analyze, the let's say access really to drugs in Germany, I think there is basically no real access issue, right? I mean, even the kind of very expensive kind of products are basically available for the different kind of, let's say, patients, right? I think it's not that we need to travel from one region to the other, or maybe even to another kind of country, right? That is, let's say, rarely happening in very few rare cases, and that is basically normally, at least what I know, only happening when such a product is not even labeled in Germany/Europe.
Thank you. Okay, our next questions are two small questions. The first one is actually, are there any names for the next Ministry of Health, Minister of Health already have in mind?
Professor Wagschal, your first kind of guess, I don't know.
Not really, but well, if you go back, I mean, the current minister was not an expert in public health when he became minister, right? He was he had a different area, but he was a real successful minister. I would say he had introduced many laws, and he was rather successful compared to other ministers in that area. So. You should not need, that is the system in Germany. You should not need to be an expert in the policy area. If you look, for example, to education in Germany, well, it doesn't play a role on the central level, but we have an education minister. She's from North Rhine-Westphalia. She worked before that in a hotel, right? She was running a hotel, had no clue for education. What a pity, but she became minister. She had to. She was a woman. That was the first reason, and she was from North Rhine-Westphalia, and they needed one from this country. Point. Period. Therefore, she became minister. She was a total disaster in the policy area. So you can have luck, but I would say, I would guess it will go to the Greens when they will have. The coalition with the Greens. I think it's more a Green subject, and they're quite interested into this field. That would
I would agree. I think if it might be a kind of conservative Green kind of coalition, I would rather as well tend to say it might be a kind of ministry for the Greens. I think on top of that, I think it's obviously very similar to, I think, on a regional level, right? I think the education kind of ministry, the same with the health ministry. It's, let's say, you can basically only lose in a way, right? I mean, I think I would agree. I think Jens Spahn probably did, I would also agree. I think he did probably a really good job, but I think he was also, let's say, I would say a very good negotiator by putting a lot of different options, a lot of different opportunities, I think in the whole kind of field, sometimes even per week, right? And in that way, I think he could as well, let's say, drive, from my perspective, a lot of those different kind of, let's say, rather system or process changes into that kind of game. So it's not so much really that you need to be a content expert, but I think it might also be that you just need to have the drive. And I think, as you just said, maybe also a bit of luck, depending a bit on the political, let's say, structure and the results of it.
The will and skill of a politician is a very important factor.
That was a really nice word. So one last question before we end. Can a health policy decide the elections?
Well, if you add up the corona pandemic to health policy, I would say yes. If you subtract this from health policy, I would say it's important. I show you the data, but then I would say only to minor extent. But an important factor in Germany is, of course, the media. And if they want to recognize that the system change would be a hot topic for the next 4 years, then it might gain in importance.
Okay.
Yeah.
Great.
Perfect.
Thank you, Professor Wagschal, for this wonderful webinar. That was really fun. We got also credits here from the audience. That's really nice. And let me point out here also, Stefan, thank you too. And we're coming back August 26th with Bibiane Schulte-Bosse, tough lawyer. And we have something about price negotiation here, a webinar, Live or Let Die or Die Hard. Discuss that with her. And then in September 30th, we go to Austria with our good friend Thorsten Peske here, and the pragmatic reimbursement pathways in Austria. That's actually really also interesting when we compare Germany and Austria, right? Like also with the pensions funds and all the healthcare system and so on. Yeah. But they just do it in a different way.
Also the changes in terms of healthcare now in Austria, right? So it might be maybe something interesting to see how they now as well change the whole kind of system. Obviously, smaller country, but let's just see.
Yeah, and then on October 27th, we have our great guest here from the Federal Joint Committee in Berlin, live, Dr. Matthias Berlet here, the good, the bad, and the ugly, and we talk about the experimental coverage in Germany. And that topic, that's for sure for tonight, that won't decide the elections. Great, thank you again, Professor Uwe Wagschal here. Greetings to Freiburg. That was fun, and also Stefan here. And then you two all have a nice vacation. Have a nice summertime.
Okay, bye bye.
Bye bye.
Thank you all. Stay safe. Bye bye.
Bye bye.